While the doctors and government flex muscles, an unwanted visitor, Mr. Patrick Sawyer, came into Nigeria from Liberia with the highly contagious Ebola virus, which has been ravaging 3 West African countries of Guinea, Liberia, and Sierra Leone since March this year.
2 days ago, that is Tuesday, July 22nd, the Lagos State Ministry of Health received information concerning a suspected case of Ebola virus disease from a private health facility. Details of the suspected case were obtained from the health facility, and this includes that he is a 40-year-old Liberian working for a West African organization in Monrovia, Liberia, who arrived in Lagos on a flight from Monrovia via Lome on Sunday, July 20th at about 4 p.m. The patient was admitted and detained on suspicion of possible Ebola virus infection, while blood samples were collected for testing.
His blood sample was taken to the advanced laboratory at the Lagos University Teaching Hospital, LUTH, which confirmed the diagnosis of Ebola virus disease. This result has since been corroborated by other laboratories outside Nigeria. Despite the urgent specialized barrier nursing care provided for the patient in a Lagos hospital, and as well as intensive support therapy, the patient unfortunately passed away. The following specific measures have so far been taken. All the passengers that the patient came in contact with have been traced and are now being investigated.
From there, a number of primary and secondary Ebola cases emerged. The Minister of Health, flanked by his counterparts in information and other health officials from the Lagos State Ministry of Health, shares the latest data on the Ebola virus disease in Nigeria.
We have additional 2 confirmed cases. So the total now, we have 9 confirmed cases, of which 2 are late. The same 2 we told you about, the index case and the health worker. As we talk, we do have 6 suspected cases currently under investigation. Sometimes they turn out to be negative, sometimes we have a few who are positive, as we have experienced between Tuesday and today. Now, altogether, all those who have placed under surveillance stands as 139 now. Government also approved that all those participating in the care of Ebola virus disease patients and also even participating in contact tracing, all those part of the team should enjoy life insurance provided by government.
While the health authorities are trying to contain the spread of the Ebola virus, they have another challenge with some form of misinformation going around the country on the use of salt and water for bathing as a form of protection against the virus. A claim the minister said can only aggravate an already precarious situation.
Absolutely, it's total rubbish. It's a wicked lie. There is no evidence. There's no truth. It doesn't make sense that when you pour water on yourself and rub salt, if anything, you're going to have other problems. Let's manage with Ebola virus disease. Don't give us non-communicable disease, please.
This is definitely not the time to peddle unfounded rumors, but a time for everyone to remain calm, cooperate with the government, and also take protective measures against the Ebola virus. Efforts to save the Ebola patients and contain the spread of the disease continued, with successes recorded as some of the patients fully recovered.
You treat a patient based on the presentation. If the person presents with diarrhea, vomiting, you have to replace fluids and electrolytes. If the patient presents with pain and that kind, you have to give pain. If the patient is infected, based on what they say, you give antibiotics. It depends on the presentation of each patient. But I know they have enough drugs, enough medicines to take care of all those things. If they require intensive care, that is part of it again, part of the equipment that have been brought in, they will be provided.
Perhaps the Ebola containment efforts would have yielded a faster result if all hands were on deck, but the doctors remained on strike. The federal government seemed fed up with the strike by the doctors, and so on August 14, 2014, the government announced the suspension of doctors' residency program in federal government hospitals, pending the conclusion of the ongoing appraisal of the challenges in the health sector. The doctors kicked, but government remained adamant in its decision.
It is true that they themselves have not been working for almost 2 months now. Resident doctors working in government, except those working in private hospitals, resident doctors working in both federal and state hospitals, almost 2 months now, have not been working. They've not participated in the control of this Ebola virus disease. They've not played any role, absolutely. So even if government has not taken any decision at all now, they are not working. They are not there. I don't know why suddenly the media starts taking interest in them. Were they working? They are not working. They are not part of this success story. But what happened was that it's like when the aviation industry, when you refuse after buying ticket to fly and you don't come, they say no show. You didn't show up and they even penalize you. So there's no show of the resident doctors. Now, even government is still paying them. People who are unemployed, even some doctors who say they are not employed, may be asking government a question. Okay, is it because we never had an appointment letter? What is the difference? You are paying people who are not working. We too are not working. Why are you not paying us? Sometimes we need to think deeply what we do to ourselves in this country. Okay, fine. So now government says, within this period, we've been trying to see how to reorganize even residence period. It's okay, they are not there. Why can't we use this period to reappraise properly this program and come up with something that can help the country? Because training of a doctor, just like any profession, whether it's engineers or anything, people need to be trained properly.
The suspension of the residency program may have forced the hands of the doctors to suspend the strike on August 24.
After due deliberation, delegates arrived at the following resolutions. 1. Delegates resolved to suspend the strike action in the interest of urgent national emergencies while negotiations continue. Consequently, all medical and dental doctors are hereby directed to resume duty at their working posts with effect from 08:00 hours of Monday, 25th August 2014. 2. The Nigerian Medical Association remains committed towards the health of Nigerians, and we to reiterate that she will not renege in her resolve and total support for the government in the effort to provide quality, affordable, and accessible health services for the Nigerian people. The NMA mandates her state Ebola monitoring committees to continue to liaise with the state governments to immediately set up emergency response teams for the prevention and treatment of any outbreak of the Ebola virus in their various states.
That action was reciprocated with the lifting of the suspension on doctors' residency training by the federal government. Let's go on a quick break. Health News will be back with more of the events that shaped Nigeria's health sector in 2014.